Hello, my name's Cole Fortman, and I've been doing automation since 2021. And the following is a real client call going over a case study for a project that I just finished with this client. The project itself, we'll go into it detail, but basically it is a invoicing system for clinical trial testing. So if you're familiar with clinical trials, usually there is many participants. Each participant has a number of visits, and each visit itself will have a number of invoice items. So if you have a larger clinical trial, it gets to be quite a lot to keep track of in terms of what is being paid, what's being invoiced, what isn't. So we built a very simple and sleek Airtable solution that is very easy for the client to use to invoice and create invoices. The stack for this project was built using Airtable, Make.com, and QuickBooks. So, without further ado, let's get into the interview. But yeah, I'm excited to chat today. I don't know if you saw the meeting agenda. I changed it up to actually reflect kind of what I wanted to go over. So yeah, just kind of wanted to get any other, if there's any other little insights or feedback you have about the project, as well as discussing anything new you have for automation or anything like that. And then finally, how can we take everything we've learned from this project and approach other people and try to, recreate the same success with them.
Right, yeah. So I'll go back to bullet point here. So your agenda, the project review, scope, impact, results, and then feedback. So in terms of the scope, I think it's in terms of if I look at like a SMART goal, it's very specific, right? We had a very specific project with a limited scope on it. I wasn't trying to recreate the entire billing system. What I was trying to do is just create a manageable invoicing system that could be done essentially by anybody, right? Anybody could do that. It didn't have to be me. And I think, you pulled it off like really brilliantly. I went through the structure of the tables and then the automation too. Yeah, in terms of the functionality of it, like the form, it was very simple. We had the invoiceable items on there that you added in there worked seamlessly. I had to do that because we had to do some reconsents on some patients, and so they were unscheduled visit day. So the form actually complied with that. It actually made it more adaptable, I would say, flexible. It's flexible in that, yeah, we do have these specific visit days and they are, structured with these line items. We know that for each one, but, we got a new consent and, I didn't foresee that happening, but because we're already kind of, asked you to add that component to it, it did what I needed to do. So, and I literally just got paper at 10 minutes before I logged in here. So, oh man, yeah. That definitely worked.
Really quick, if you're enjoying this kind of content, please be sure to click subscribe down below for more content like this. Another thing that would be very helpful for me is to understand like what is what is the problem that this solves and like the impact of solving that problem. Like for this, like I guess like because I want to try and use this as a good case study, and some people might not understand how complex invoicing is for clinical trials. So I think if you want to go into a little bit more about like why is the whole process so complex and complicated, and kind of like why is it such a pain or a problem, and is this something that other companies have as well?
Yeah. So I I don't have a huge sample size, so I don't know how big of a problem it is. I do know I've heard from two other well-established clinical trial clinics that it's a problem for them. In terms of like, the smaller size practices, there's a ton of just, I talked to this company called Clinical Trial Gurus, and they help clinics like mine get clinical trials into their clinic. So they're not doing 20, like they might be doing like 3 to 5 clinical trials per year. And like they're not, those clinics are not going to invest tens of thousands of dollars into such a sophisticated system, right? There's if you don't have in clinical practice, like we have electronic health records, we submit billing to insurers through the SOAM platform. You know, there's these complicated insurance portals that does not work at all in the clinical trial space. Like it's totally separate system, right? We're not doing any insurance billing on this. This is going straight to the sponsor. So the problem is that for each one of these visits that come in, every visit has different line items that we have to bill for based on that visit. Some visits are similar to other visits, but most of them are pretty unique on what you bill for. So, and then there's also invoiceable items. So things that you can add on to that particular day. So you could, if you miss what you're invoicing for based on that visit, because like that first screening visit, I'm billing for, I think
Like 10 different things or something?
yeah, well, this next budget, it's more. Like I think I'm billing for like almost 20 different things.
Oh, wow.
So I have to pull it up. It's a lot. Like there's a lot of different assessments that had to be done that you get to bill for individually. So if you don't bill for it, they're not checking that to make sure that you're getting paid for the work.
Hey, we owe you more money.
Yeah, they're not going to do that, right? So you're just gonna, and I just, I saw it on my end too with the contract that I just, I'm completing now. I'm negotiating. It's like, oh yeah, like we need to get paid more for these, but also we need to have line items for things that aren't encompassed in here. So like, if you're not hitting all these boxes on your invoicing and you're just relying on someone to go through your visit day and individually adding in like that introduction,
Manually.
you're introducing human error, right? When you do it manually, you introduce human error. There is no question about that. I've heard that from my colleague, but I've seen it now when I did it, myself, and I looked at it. I'm like, oh yeah, like if this participant, screening visit versus is it, visit one visit or visit two visit. I'm going through it. I'm like, you could easily just miss it just because there's so many visits. Like, for this study, it's less. There's like I think 16 total visits. That's still 16 total visits. That's different. And with
Times like 10 to 15 invoice items times every single participant. That's,
yeah,
yeah.
yeah, yeah. So if I have, 5 different people coming in a week, like I don't think how much time that would be. Like if
Hmm.
that's a lot of time I'm spending in just to proof things and make sure that what I'm submitting is accurate, right? I don't want to do that. Like I'm not taking that on, and like I'm not putting that on my staff who have no understanding of the importance of invoicing properly, right? They're not going to know what assessment was done, and like
Okay.
even if I gave them like a flow sheet on what to do, like you're still introducing human error on it. So like to me, like when I used our platform here, I got paid for all those screening visits that I did using this invoice. And all I had to do was just make sure that we had the right participant ID number. That's it. Like that's your in the right visit day. Like that's it. Those are the two, variables that could be like, could be
Essentially,
anyway.
yeah.
Yeah, that's it. That's it. I've limited it to that. If you mess those up, then yeah, your invoice is going to get rejected. But like, I don't, I just copy and paste. So that just eliminates that human error factor. So that's the biggest problem. And then the other problem would be that I could see is just follow up on invoices. Like I think like maybe having because like like I said, they're busy and in our contract. So this next contract I put in, like I put in payment of indisputed invoices to be paid within 30 days. So I think at that 30-day mark, if they're not getting it in, like having a follow up, it would be something of supreme benefit because I did see that. So I'm pretty busy working on these things, but I look back and I was like, oh yeah, they have their hands on this. I haven't heard anything that's been rejected or anything, and I just followed up and like, oh yeah, yeah, we're getting to it. So it's not like anything was done incorrectly. It's just maybe pushing them a little bit. So that's the other thing is like some invoice, all right, what happens to it afterwards? Like, is it going to get paid? After getting paid, and I think having that automated follow up too would be a substantial benefit for them because then like you don't have to review it. Like all you have to review is if it's paid or not. That's it.
Mhm.
And so, and then it automatically does follow ups for you. I think that would be the supreme benefit for any client because those are the two big things. Like, are you billing properly and are you getting paid? Right. So,
Or even when you do get paid, it automatically marks the invoice in, say, Airtable. It'll mark it as paid there as well.
yeah, absolutely. Yeah. And that's, I pulled up the table. Like, I go pull up the table. I can see all that on there that, it's sent, but if it updates that it's paid, like, it's like, all right, yeah, this is a real deal now because all all I have to do, and if I can get it by participant that gets through, all 16 visits, like I can track that particular participant and saying, all right, they're paid up to, visit 5. And we've got 3 more visits that are pending on this person. So I can see it all. And then kind of the big things I think in terms of challenges that the clinical trials, the problem per se is, lack of ability to do it efficiently, the time required to make sure it's done well, um, the reducing the rate of denied invoices based on certain factors, and then follow up on them to make sure they're being paid within the not being paid on how it's defined in the actual contract. So if you have that, and then you can run reports based on it. If you have all those things, you solve the biggest billing invoicing issue clinics my size that are participating in it because that's your target market, right? Your target market's going to be like a clinic like ours that isn't. I'm not a huge clinical trial site. I'm a clinic that does clinical trials, and if there's thousands of clinics like mine across the country, so if you can give them a solution like that, and more clinics are trying to get into clinical research because they want to, lessen the demand or lessen their reliance on clinical care and insurance reimbursements and all the headaches that go along with that. So if you give them an extra revenue stream, the idea of extra revenue stream is very enticing, right? But the reality is, like, if you don't have your invoicing system in place, then you're not getting paid for all the hard work you're doing. And it's a lot. It's a lot. Like, you want to make sure that you're getting paid. It's not like doing clinical work
No,
enough. So
I bet
that's
you.
great.
There was also, you had mentioned one like example company a while ago that I think they missed out on like literally like $1 million of invoices or something like that. Is
That's
that
correct. Yeah, that's correct. So I talked to Lane, Dr. Payton. Got a clinical trial. He's got a clinic site in Oklahoma City, and I think they're running about 6 or 7 clinical trials at a time. And he's got a pretty robust clinical trial wing for his company. And so it's more than one study, but it's multiple studies over the course of the year. And they did their audit on it, and they had lost out on a little over $1 million based on just poor invoicing.
wow?
That's real, like, that's actually real.
And they're not even like a giant clinic, right?
No, no, I showed him what we did here, how I'm using it, and, like, he was like, "How did you know how to do this?" And I told him that, like, this is, the most sometimes the best solution is the simplest and most elegant, version of it, and I think that's what this particular automation that we created does. It's very simple and elegant, but it doesn't need to be the Cadillac, right? You're not making a Cadillac, we're just making something, a Toyota that runs very well and precisely, and it's very affordable.
So that wraps up the interview. And if you are a clinical trial testing company and you're looking for a solution like this, please reach out to us using the link in the description of this video. And if you enjoyed this content and are looking for more automation and AI content like this, please be sure to like, comment, and subscribe. I'll see you next video.